So I now request Dr. Rishi Raj to present his talk on a tsunami of vision impairment, comprehensive management, myopia. Dr. Rishi Raj, please.
Good morning, everybody. I am going to present my talk upon the myopia. As we all know, the most common cause of the treatable and preventable visual impairment is the uncorrected refractive error. And the myopia is the most important because why this discussion? Because as we all know, myopia is increasing and now it is a global epidemic. Wearing spectacles is a new normal. By the 2050, 50% of the world population may be going to be affected due to myopia. And the various studies, it has been shown that is going to be affected almost every second person by 2050. So myopia is an emerging public health issue in India. About 1 in 5 school children in India are myopic. They need spectacles to see. As of the October 2020 survey, in the urban population, it was around, the prevalence was around 8.5%, while in the rural population, it was around 6%. It was highest in the 10 to 15 year of age group and 15% more than in the last decade. So myopia is not just a refractive condition. It causes axial elongation, it causes outer course stress, that's why it causes lots of ocular complication that can cause even blindness. So the single agenda worldwide to control the myopia is to control the eye length. It's hard truth that the once myopic is a forever myopic and impacts the quality of life in some individuals. So there are several anti-myopic studies available, but the most common is the environment and lifestyle modification, different type of contact lenses, and the pharmacological intervention in the form of low-dose atropine. The number one is the orthokeratology. This is a kind of non-surgical treatment that uses specially designed rigid gas-permeable contact lenses to temporarily reshape the cornea overnight. It's based upon the push and the pull therapy, which causes the central thinning of the cornea and the mid-peripheral thickening of the cornea. So who can benefit from the ortho-K? The patients who are progressing and they typically up to -6 diopter of the myopia, and those who want to avoid glasses during the daytime or daytime contact lenses like the athletes and the swimmers. Is the benefits of the ortho-K's causing slow myopic progression. There is no need for the daytime glasses or contacts, so these are ideal for the active lifestyle, and this is safe and non-surgical, so suitable for the young children unlike the laser vision corrections. But there are risks with the orthokeratology in the form of risk of eye infections, initial discomfort, and it's not a permanent solution. So when we prescribe ortho-K, there is an initial adaptation that will take 1 to 2 weeks, and then the follow-up regular checkup is ensure the effectiveness and the eye health. The second option for to control the myopia is the spectacle lenses. The lenses that we prescribe normally that clears only the blurry vision, but it doesn't control the myopia. So there are some special lenses to control the myopia. These are DIMS or HL lenses. The DIMS, that is the most common lens that is used for the myopia control, like the Hoya Myosmart. It features a central clear zone with the surrounding of the hundreds of tiny defocus segment, which causes the focusing of the peripheral light in front of the retina and signaling the eye to slow down its growth up to 60% is effective to control the myopia as compared to normal prescribing lenses. The another one is the HL lenses. There is multiple aspheric lenslets to create the myopic defocus. The another myopic management progressive lenses also, but they are not so popular as compared to DIMS and the HL lenses. So the benefits of the myopia control spectacle lenses, this is non-invasive and easy to use, effective in slowing the myopic progression, suitable for the younger children, those too young to use for the contact lenses or ortho-K, and they are comfortable and safe as compared to the RGP lenses. But the consideration is a higher cost and also a not a permanent solution to control the myopia. So we can consider these type of lenses in the children, those who are progressing with the myopia and who are struggling to use the contact lens and ortho-K. So parents looking for an easy and safe way to manage their child's the myopic control. The third option is the pharmacological option, which is the most commonly used nowadays, especially in the form of low-dose atropine. In India, it's available in the form of 0.01%, 0.05%, so I think going to be soon available in the India. The what is the mechanism of low-dose atropine is not clear, but the most probable the thesis is this: it increases the dopamine secretion, and there is a restructuring of the scleral fibroblast, which causes decrease in the axial length progression. So in the different concentration, 0.01%, 0.025%, 0.05% is the most effective. In the ATOM study, initially 0.01% was used was used, and it showed there is significant 50% reduction in myopic progression, while in the LAMP study it was shown that 0.05% is more effective as compared to the other concentration of the low dose atropine. In India, in AIMS, ARM study was performed. It also showed that the 0.05% is effective as compared to the other concentrations of the low dose atropine. So, in the children, especially with the 5 to 16 year of age, and who is showing the progressive myopia in the form of 0.5 diopter per year or more, and we can use with the combined method also. It's more effective as compared to the single use of the low dose atropine. So we can use it with the ortho K or the lenses, DIMS or HL lenses. So the use of the low dose atropine that is proven in the form of highly effective, easy to use and minimal side effects, and also used as a combined therapy. But there is chances of the it requires a long term follow up, long term use at least for 2 to 5 years, and it's not a permanent solution. In this, some patients they show a possible mild side effects in the form of slight near vision blurring. So in the patient, we can start with the documented progression of the myopia. They need regular follow-up every 6 months, and after there is no progression for consequently 2 years, we can taper off the low-dose atropine. The most important thing to control the myopia is lifestyle changes, because myopia is a lifestyle disease. So in addition to medical treatment to control the myopia, lifestyle changes is the most important thing. Uh, uh, the number one thing is the increase the outdoor time. Spending at least 2 hours per day outdoor has been shown to if significantly reduce the myopic progression, because it stimulates the dopamine release, which helps slow myopic development. It reduces prolonged near work, a key risk factor for the worsening of the myopia. Number thing is the follow the 20-20-20 rule, because it reduces the stress on the ciliary muscle and helps prevent eye fatigue, which can contribute to myopic progression. Limit screen time and near work, because it reduces the excessive screen time, especially with smartphones and tablets. Avoid using digital devices, especially in dim light, and maintain a reading distance of at least a arm length of 30 to 40 centimeter. Maintain good eye ergonomics in the like a proper lighting, sit a comfortable distance, use adjustable chairs and desks, and avoid reading while lying down or in poor lighting condition. It helps in prevent eye fatigue and maintains a stable focusing system. Get enough sleep and manage eye fatigue. Ensure 8 to 10 hours of sleep. Avoid screen at least 1 hour before bedtime, because poor sleep and tired eyes can contribute to faster myopic progression. Maintain a good healthy diet for eye health, vitamin A, omega 3 fatty acids, zinc and vitamin. While diet won't stop myopia, but it supports overall eye health and reduce the eye fatigue. Encourage a balanced daily routine, mix outdoor activities, hobbies that don't require a screen. So these all combined efforts can simple lifestyle changes can help in reducing the myopia. The number one is the minimize screen time. Number two, ensure good light levels and maintain a distance and posture during any near work. Thank you.
Thank you, Dr. Rishi Raj Singh, for covering this absolutely important subject. And this is the need of the hour at present, because particularly in children after COVID-19, there is an increase in the myopia, and whatever you said, that is, I think, very, very true, and particularly 0.05% of the atropine, that is much, more effective.
More effective, sir.
0.01 is not, I think, so effective.
So